Hi everyone. Today we are uploading our second video of this session by Dr. Hemalata. She is gonna explain us a very important part of this session, fitness for female dentist. I think this is most important because many of our friends, sisters are away from their fitness journey because they have to take care of clinic, they have to take care of home, they have to take care of children. Many things are there, so hope this video will help you out. And I know Hemlata since my college days, as we are the batchmate and best friends. So I know her fitness journey because she is managing everything proper way. So hope this her tips will be help you out for your fitness journey too. So we'll move to the video and take care yourself and stay home, stay safe, guys.
Hi all, this is Dr. Hemalata Rokade. I'm a cosmetic dentist and implantologist and professional fitness and fashion model. Founder and owner at I Am Fit, the platform under which we conduct the workshop fitness especially for the dentists and dentist females. So I hope all of you guys doing great. All of you are staying home. Stay safe, stay healthy. Yes. So today my topic is fitness, and I'm going to talk about it. Uh, yeah, mostly about the female fitness because I myself a doctor, a female, a mother of 5-year-old, and a fitness model too. So how am I balancing all these roles? I would love to share the small journey of mine. To start with, how I become, like, I'm a dentist and how I become a fitness model too. So I never thought of becoming a fitness model, but I was like always being a ardent follower of a fitness, always being an athlete throughout my life, throughout my school and college days. I was knowing the importance of being fit. So we all go through the phases in our life. Likewise, like, I also went through the bad phases. I would say that, like, I was a pregnant first time, and I had to abort the first pregnancy in the fifth month because of some the growth issues. And obviously I also had gained some weights during that pregnancy, almost like 12 to 15 kgs. And what I was knowing about me, that my strength is being into fitness, working on myself to get more fitter. So I started working out on myself. I started doing certain kind of exercises, and at that point I realized that something like the weight gaining, which is a very very important for each and every female. And I also understood the importance of weight training that point, and I started doing that, and I lost my whatever the extra gained pounds during the pregnancy, and I lost every grams of that. And the what important I understood throughout the journey was the importance of a weight training. And I started knowing about it slowly, and that point I was very much clear about my you could say the next fitness journey, because obviously I was about to the conceive my second child, and I had decided, I had everything in my mind, every plan. So when I conceived for my second child, I think 1 month postpartum, I was in gym, and I was like working on myself to get rid of that extra pounds, obviously, which I had put on during the pregnancy, and which is unavoidable in many cases. Almost in 95%, it is unavoidable. Yeah, I was doing some exercises throughout the pregnancy, but somehow I couldn't continue because some issues, some the back pain issues. But the post 1 month of delivery, I started working out on myself. I started working on my diets. I started working on my the programs, what kind of training I'm doing. Obviously I started doing weight training immediately. I am going to come on that, why the weight training is so important. And within a span of 1.5 year, I lost whatever extra kgs I had put on during that period. Almost 25 kgs I lost, and it's not just I lost some fat or the weight. It was more than that. I became so fitter and so stronger that I had never been in my life after the delivery of child, and that was something amazing. So for me, fitness is being fit mentally and physically. We all, we tend to gain weight in our life, like, because of different reasons which are unavoidable also. For example, the pregnancy. What I feel, we female are the backbone of our family. We should be stronger enough to take care of our people. So we have to work on our health. We have to work on our mental and physical stability, which is going to help us in turn having a good future with our family and our kids. That is what very important I feel. And obviously, if you really want to success both professionally and the personally, you'll have to work on yourself. That is really very important. So this was my journey, and how I developed love for the weight training. Definitely, I'm going to talk about the weight training more, because I feel there is a lot of misunderstanding regarding the exercises. A lot of, I get a lot of questions from a lot of doctors. What exercise should be done, or shall I do the cardio only, or why weight training? Is it really necessary for the females? And all these things. Before that, the most important question that females are asking me, how do you balance all this thing? I mean, do you have a different watch? So I'm like, I really don't take a lot of efforts to do that. It's just my schedule, it's just my lifestyle. So it's simple. Like, if I'm a dentist, you guys, like, most of you are dentists or doctors. I understand the people who are attending the emergencies and all that, but they have to, look into their schedule and manage accordingly. But the dentist, I'm being a dentist, I know we dentists have a kind of fixed schedule. Some of us are working in the 2 shifts, some of are working in a single shift. Like me, I'm working in a one slot only, like 10 to 7. So if I'm working like 8 to 9 hours, considering, so I still have 14 hours left in a day. And if I'm sleeping for 8 hours, I still have 6 hours in a day, out of which I just need 1 hour to work on my physical fitness, which is going to give me a lot of benefits out of that. So why I'm like, not getting, or not, I'm finding it so difficult to take out that 1 hour. This is a simple thing. So what happens is, basically you have to prioritize your things. If you give priority to your health, to your fitness, to your exercise schedule, obviously you're going to find a time for that, definitely. So it's all, about properly planning your day. So my day is planned accordingly. There's no change. It's very simple. Like my clinic, my the workout time, cooking also. Like I cook myself. So why I'm telling you is, like, it is not impossible. Trust me. And if I'm cooking myself, the diet is also very good. If your schedule and the your routine is planned completely, I mean, every day you just have to follow that. Sometimes some cheats are like expected, and which is mandatory also. You can do that every day. Just eating outside food or not doing any physical activity, it is more boring. So if you just plan your day properly, there's nothing difficult, I would say. I'm a mother also. I'm a wife of a surgeon who is like brain and spine surgeon, who is having a lot of emergencies, and that's why I have to take care of my whole family. So what helping me is my fitness. Because of fitness, I'm very strong mentally and physically, and I think that is helping me a lot. So it's just simple thing: plan your schedule, plan your diet, and plan your exercise. Everything is going to be very easy. So this is little bit I just the spoke about my journey and how I feel with the fitness. There are certain the points which female doctors they keep on asking me. I'll come on that and we'll discuss that. Okay, so when somebody wants to start with the exercise, they do some mistakes before that. Like what they think. First of all, they set up some unrealistic goal, then overcommitting themselves, and always in a search of shortcuts. So what is setting unrealistic goal? So people who have gained some kgs over the period of time, some years, they just want to lose it in a month or 2 months, which is scientifically impossible. You can lose 2 to 3 kgs in a month, which is in a healthy way. You can expect more than that, but not like 10 kgs or the 15 kgs. So don't set unrealistic goal. You can't lose the 15 kgs in a month. That is totally impossible. So what happens is like you lose, you start losing faith in exercise and you stop doing any kind of activity. So there you not continuing with your fitness or the exercise. So please don't set unrealistic goal. The second one is overcommitting yourself. Like if you think I'll just have some goal in 2 months, I just want to lose, and what I'll do is like I'll work out twice a day and each and every day, like including Sunday, and I'll do this diet and that diet. Don't do that, because practically it is not possible. We are not into this profession or the sports, I would say. We are professionally something else. We are doctors. We have to work on other the aspects also. We are doctors, we are working, we have a family. Why we are doing going into this, the fitness, which is very much required to perform our other activities. So just 1 hour of a day is sufficient. Little more than that, 1.5 hour is if you really want to be get into it with a good kind of intensity training. But if you are thinking overcommitting and the overcommitting overcommitting to this kind of a workout or the the gym, I can achieve my target within a given within a time which I have decided. That is not going to be possible. And many of them are always they just don't do anything. They just try different thing, like always in a search of shortcuts. No, I just want to lose this much, so I'll just go and find out that diet, the particular diet, and that diet helps a lot, and you just have to eat this and you lose 7-8 kgs like that. So I don't think so. Okay, this is going to help you, because you need to understand the nutrition sciences also. If you are a person who's been eating all life carbohydrates, how can you just stop the carbohydrates, not having the carbohydrates? That is not going to help you, because you are not going to continue that diet. You're going to stop it as once you start seeing the bad effects of the diet, unrealistic diet you are following. So the people, they keep on searching the different diets, the diets who are they are promising the losing weights in some magic numbers, then some shortcuts, they follow some people like they're having amazing bodies, but they fail to understand that these people, they are working hard since long. They are putting a lot of efforts into it, and that's why they have come to this level, this stage. So we have to understand that. We have to understand what is our goal. Our goal is, if the person is a bodybuilder or the athlete or the into such kind of sports, they have a different schedule, they have a different routine, they are totally into that. we are not totally into that. We are doing this, we just want this thing as our lifestyle. So we'll have to work accordingly. It will take a time, but obviously, if you are consistent enough, you are going to achieve. If you really want to achieve things like if you have some idols, so the planning, determination, dedication, and the most important thing is the consistency. If you are consistent enough, you are never going to fail, and you are going to find your right track to reach to your goal. So commonly asked question to me, by the females are why they should be doing weight training, and is spot reduction is possible. And they have a fear of if they do weight training, they are going to look very masculine. Uh, that's again a myth. And then spot reduction. So spot reduction is the biggest myth again. So in this commonly asked questions, so I'm going to cover 2-3 things in this, which is going to be a metabolism, weight training, why weight training is important, what is a calorie deficit, what kind of a diet we should be consuming, and what are the benefits of doing weight training. So why weight training? So basically, women, they have a fear of doing weight training because they think that they tend to look masculine or the bodybuilder. So if they have seen such kind of images that females are performing some weight training task and they look masculine, so these kind of females, they are into that sports, bodybuilding sports, and their routine is totally it's completely different. We because the intensity they are training themselves, their diet is totally different, so we cannot compare ourselves with them. So why we should be doing weight training? The most important thing, the weight training helps us to increase BMR. Now what is BMR? Which is basal metabolic rate. What is basal metabolic rate? The basal metabolic rate is the calorie taken by body, or the required by body to perform or to accomplish its basic functions at the rest. I mean, like for example, I'm speaking, my body is burning some calories because I'm doing a task, I'm doing one kind of activity. So my body is burning a calorie, which is called as a metabolism. So the metabolism is very important. If your metabolism is amazing, is very high, you are not going to gain weight that easily. If your metabolism is very sluggish, then definitely you going to gain weight fast. So you have to work on your metabolism. So how to work on that metabolism? Weight training. When you do the weight training is nothing but we are performing some kind of a movements with the help of your muscles. So we are actually working on the muscles. So when you work on the muscles, there's increase in the lean muscle mass, and when there's an increase in a lean muscle mass, remember this, I'm saying the increase in a lean muscle mass, I'm not just saying the bulking up the muscles. Okay, so the increase in the lean muscle mass, I'm not talking about the size. So when you increase that thing, increase in the lean muscle mass, you burn more calories. So for every pound gain in a muscle mass, you can burn more 30 to 35 calories. So if you are having a good muscle mass, you are burning more calories and your BMR is very high. Your metabolism is really good. Your body burning calories at the faster rate. So if you are performing weight training, your metabolism is very good. So this is the one thing that which is very much important, metabolism. Then come to the spot reduction. Spot reduction, I get many questions asking, can I reduce some extra fat from my thighs, from my buttocks, from my tummy? I want to have a flat tummy from my arms. Spot reduction is a myth. Spot reduction is not possible. if you really want to lose weight, you'll have to work on the whole body. You cannot just say that I have an extra fat on my stomach, I'll be doing crunches and I'll be losing fat and I'm going to have abs. So it is not going to happen. Yeah, you need to do crunches, but along with some compound body movements. So you are going to reduce fat equally, proportionally from overall parts of your body. You cannot just you cannot just lose fat from particular part of the body. Yes, you can do isolated exercises, but again, those are for all for the building up that particular part of the body. But the compounds movements are always recommended. I know the compound movements, most of you must be aware of the compound movements, and most of you maybe not. We'll talk about it later, but there are like some compound movements like squats, then some deadlifts, some press. These are the compound movements in which your whole body is working at one time. Your all muscles are working at one time. So these are really important, getting into all kind of compound movements and getting into the isolation exercises. That would be the later part. So yeah, this is one thing. So you cannot just lose weight from the particular region. You have to work on the whole body. The fat will get reduced proportionately from your body. Then nutrition, little bit about nutrition I would love to talk. You have to take care of your macros, like carbohydrates, proteins and fats. This is important. Diet is not eating lays, or diet is not eating some boiled vegetables, some boiled things, or the soup. It is not like that. Diet is very much individualized, very much customized for every each person. If my habits are different, my diet is accordingly my eating habits. I have to plan my diet accordingly. So diet is eating a proper food in a good amount, in a correct portion. So the portions are important. Like if you are eating carbohydrate, protein and the fats, then again you'll have to you have to be very careful while eating those macros. Like you'll have to for example, protein has to be first part, the maximum amount of protein you are eating, like 70% protein, or a 50%. If you are eating 50% protein, then 30% would be the carbohydrate and 20% would be the fat. So accordingly, this is not a generalized, because there are number of diets available. We can like go like that. But when it comes to normally what should I eat, then just go with this rule. Like the protein should be in high amount, then carbohydrates and the fats. So this is all game of calories. So how much calories you are consuming is very important. So if you want to lose weight, then you have to be in a calorie deficit. So what is calorie deficit? If your daily requirement is 2000 calories and you are eating 2000 calories, then you have to go into deficit of 500 calories. So you have to consume only 1500 calories. So you are going into the calorie deficit. So you're consuming the less calories. So obviously you are going to lose weight. The same thing applies if you want to gain weight. Then you have to surplus your calories. You can't be in a calorie deficit at this in this particular situation. So calories are very important. Counting your calories is very important. Now you'll ask me how to how to count those calories. We don't know like each and every food having how much calories. It's very simple. Don't make it complicated. Download some applications. They are very easily available. Like where we can keep a track on our calorie consumption. There's one application which I also have. You just have to put what you are eating and they'll show you the approximately calories. So if your plan is like 1500 calories, so accordingly you have to calculate, manage your diet and plan your diet. So how much protein you required and how much carbohydrate you required. This is a very basic nutrition I'm talking about. We cannot just complete all the things in this session, very small session. So this we done with that. We spoke about the metabolism. Then why weight training? Weight training is very very important in cases such as the osteoporosis, which is happening post-menopausal. Osteoporosis is a condition where bones become brittle and they are more prone to fracture. If you are being doing a weight training, there is a lot of increase in the bone density and you are less prone to the fracture. So it is proven that if the female is been doing weight training, she is very less prone to having the osteoporosis. With that, you have to take care of your intakes of the calcium, vitamin D especially. You have to keep a watch on this. I don't know how many of you get your body analysis or the body checkup done, but it is very much required for the females over 30 years who are mothers, above 40 years, 30 years who are mothers. They need to check their, the vitamins and the other parameters. So if they are having a deficiency, you have to consume that, and there is nothing wrong consuming all this nutrition. So just have your body checkup done. And again, we've spoken all the medical aspects of weight training, and what you finally see the results or the product of weight training is having a very very good the very aesthetic body, which is again a bonus. We are not doing weight training to have a very good aesthetic good looking body, but this is going to happen at the end. We're going to see that thing if we are doing the weight training. Obviously there are a lot of medical benefits we are getting out of it, and as we know that fat is a major risk factor in many diseases, many disorders like some metabolic disorder, diabetes, cholesterol, blood pressure, CVD and all this. So we'll have to work on this fat. Why I'm just speaking, I am not emphasizing on looking great, looking beautiful, having a great appearance, but in terms of the medical advantages, what we gain if we are keeping a track on our fat. So these are the things we should keep in mind, and I think the people who haven't started weight training yet, not even people, I would say the females who haven't started weight training yet, please start with weight training. You're not going to look bulky or the muscular, because you are seeing me. I've been doing it since last some years, I would say some 8 years, along with 2 pregnancies, and I still manage to look very feminine. It's a very kind of a misconceptions females are having about the weight training. So weight training is very 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 important. Of course the cardio along with that is very important. It should be the combination of all the exercises. And being a dentist, how the weight training is going to help us, or how the being fit is going to help us. Yeah, of course it plays a major role. If you are a dentist, then how it is going to help us, I'm going to talk that also. Now, how weight training or doing a kind of exercises, it can be a yoga also, stretches also, how it is going to be us as a dentist. First of all, we are all are working practitioners, we are clinicians. We work on the patient sometimes in very compromised position, because we tend to forget, because we are so much engrossed into our work, our procedure, we tend to forget like how we are standing or how we are sitting. So this compromised position tend to cause kind of a pain in some kind of our joint, like in back, in shoulder, neck, wrist, because these are all the muscles which has been used while operating. Basically the upper body muscles. Then even if you're doing a patient or operating a patient in a standing position, your lower back is also working. So if you're working in some compromised positions, you're going to hurt your muscles. You kind of are having a pain. Again, even the spondylitis is very prominent in clinicians. So why this is happening? Because your body has no memory. I mean, your muscles of your body has no memory working in all the planes, because you are not performing any kind of exercises. So exercises is not just weight training, it is comprises of many movements, I would say the movements. But if you are kind of performing any kind of exercise like stretches, yoga, weight training, in which your muscles are very much active, or you are training your muscle in all the planes, so your muscle node working in all the planes. And when you are operating on the patients, if you are already practicing fitness and you're operating on the patient, you will never face this problem of having pain, because your muscles are already knowing working in all the planes. So that is the beauty of weight training, I would say, or any kind of the muscle exercises you are doing. So it's my personal experience. I never ever experience any kind of a pain while operating, or having a long day, or the long operation, long procedure hours, because my each and every muscle of my body knows how to work in a different planes. So they are trained for that. So basically posture is very much important, which we learn in kind of exercises. For example, weight training, in weight training we learn how to be a form of a body, how to be a posture of body. Even same thing, ergonomics vouch for that, like this is of science which is introduced in the dentistry to have more ease. So all the equipments are designed accordingly to give the more ease to the clinician. So the same postures and the forms we are practicing in the fitness. So I think both thing, like the ergonomics and the fitness, they vouch for the good posture. So I think both the things go hand in hand. And if you really want to be have alertness, have more productivity into your professional life, just take out a 1 hour a day and work on your body. Do stretches, do yoga, do weight training, do anything. Start with anything. Develop a love for kind of a movements your body required. Our body required movements. Our body is not meant to sit at one point, one particular place. It is meant to move from one place to other. So that is something is not happening under the excuses that I'm not getting time because I have lot things to do. I know what all lot things to we have to do. We have ample of time. Just try to utilize some hour from that. Because I am also a dentist. I belong to a family where all the people are medicos. I am seeing all the all kind of a schedule everybody is having. You can surely and easily can take out 1 hour of a day. That is very much important, and I personally believe that we are doctors. We are health promoters, right? So we have to be we should set an example for the general public, because they really trust us, they believe in us. So if we are fit, we are going to give a very positive impression on them. So this is very very important. And finally, I think there are many things to we can talk about. We cannot just finish all the things in one video. definitely I would love to talk about more, like, the weight training, how the weight training is going to help you in different aspects. Yeah, we'll, soon I'll come up with some good videos. At the end, I'm adding some basic exercises videos that you can start at home, because as we are, we are all are enjoying our lockdown period. Yeah, I'm like, in fact, I feel I've got a great time to work, more on my health and to spend time with family. So why not you also, like, take advantage of that? If you are not yet started working on your health, just start some kind of doing, just start some body movements, doing some kind of exercises. The videos I'm going to attach going to show you some kind of a basic movements, so you can start with your body weight. If you are not having any kind of equipments with you, that is fine. Even the body weight exercises are difficult, so just go through some exercises which I'm going to show you, and just start it. Just do some the repetitions of 15-20 repetition, and some sets of those repetition, like 4 5 6. Do all the exercises, and once you achieve kind of a, you think you have achieved a level where you can go more heavy, or you can increase the intensity, you yourself will understand that, you yourself will understand your strength. So go accordingly. We are doctors, we are very smart, I think. And finally, I would love to say thanks to Dr. Shoaib for asking me to speak about female fitness, for especially for the dentist, which is, like, I think my favorite topic. I always keep on talking about this. And thank you so much, Dr. Shoaib, giving me this opportunity to talk about the female fitness. And I hope this is going to yeah, this is very little, I just, I spoke, but I hope this is going to at least kind of a motivate or inspire some females to start with their exercise routine. So thank you all. Stay safe, stay healthy, stay quarantine, and yep, I'll see you soon with the more content.